Welcome to the T-Level Health Core Assessment Employer Set Project, Task 3A Peer Discussion and Task 3B Presentation Overview. In this presentation, we will guide you through the details and key consideration with a primary focus on Task 3B. Please remember that the information provided here is based on data available as of September 23 and it may not reflect future changes to guidance documents. Always refer to the most up-to-date guidance. So beginning with task 3A, the formative reflection task, peer feedback. This part of the task is not credited. Formative reflection task and peer discussion feedback is the discussion of the proposed healthcare plan with peers to gain and offer feedback. This is in groups of 2 or 3. Students read the healthcare plans provided by their tutors. They complete a provided peer discussion feedback form for each healthcare plan. They hand in their peer discussion feedback form to their tutor. In the peer discussions groups, students will receive a copy of their own healthcare plan and feedback forms from peers. Overall, the time limit of 3 hours, 30 minutes. 1 hour to read peers' plans and complete feedback forms, 30 minutes to re-familiarise themselves with their plan and feedback plan forms, and maximum of 30 minutes per plan for group discussions. The students must complete handwritten notes reflecting on the feedback. The core skills that are assessed that are evidenced in this task are CS2 communicating, CS3 teamworking, CS4 reflective evaluation, and CS6 presenting. On completion, students will have a completed feedback forms. They will have handwritten notes on the feedback forms and photographs or scans of the form of digital storage. So now let's have an overview of task 3B. As in previous tasks, students continue to act as supporting health worker within a multidisciplinary care team with the aim of helping an individual achieve their care goals. This task, again, is another integral part of the project, which closely follows one individual's healthcare plan. Task 3B falls within the 2-week assessment window and demands approximately 2 hours and 30 minutes to complete. This includes the 2 hours for preparing the presentation, with a maximum of 15 minutes allocated for presenting and an additional maximum of 15 minutes for questions. Students will work under supervised conditions without access to the internet. However, they will have access to the copies of their healthcare plan, feedback sheets from task 2A and 3A. Students' evidence for task 3B includes the presentation slides or word processed materials and a video recording of the presentation. Understanding how task 3B fits into the broader project is essential. So task 2, students reflect on the feedback received from their tutor and consider how it impacts the proposed support plan for the individual. Through to task B, where they review the support that was proposed and the rationales and justifications provided within the healthcare plan. This then links to task 3B. Here, the students must bring these components together to justify the actions they're implementing, consider what changes they will or will not make based on feedback, thinking carefully about their role as a supporting health worker and the expectations of their audience. And finally, on task 4, they reflect and use on their use of peer discussion and reflection time effectively. They will consider how they utilise the feedback from their peer discussion to inform their presentation. They could reflect on their presentation and communication skills, both during the presentation itself and in the subsequent Q&A session. So this task links to CS2 communication, being able to communicate effectively with patients, carers, service users, and other health and social care professionals, using a range of techniques to overcome communication barriers. CS4, reflective evaluation through making improvements to own practice, and CS6, presenting outcomes in a range of formats and adapting presentation styles to appropriate audience. In order to effectively demonstrate these core skills, the students should include any changes or improvements that would be made to the healthcare plan based on feedback received. Reflective evaluation is a core skill, so highlighting the importance of learning from experiences and feedback. Students should adapt communication and presentation to the audience, in this case, a senior colleague. Avoid presenting as if the audience has no sector knowledge, as senior colleagues expect advanced presentations. Students should present information findings using various formats such as PowerPoint, handouts, images, tables and graphs. Demonstrate digital competence through the use of presentation software. Students should summarise key findings from research, including secondary data, and present essential information from role-play discussions such as support needs, goals and key personnel. Students should adjust that presentation style to meet the needs of the audience, including language and terminology, demonstrate appropriate communication skills, including pace, tone, body language, and eye contact, and clarify information during the presentation at appropriate points. Actively listen to feedback from the panel and showcase understanding of teamwork and collaborative principles, emphasising common goals. So now we're going to explore how to maximise students' success. So I'm going to use the Autumn 23 Grade A Exemplar alongside the descriptors for Band 3 and 4 marking criteria and the examiner commentary from the task to highlight key areas that the students can maximise success. And you can use this as an example process that could also be applied to the C&E Exemplar, giving a way to measure student achievement. So the Chief Examiner's commentary on the students' works can be summarised and cross-referenced with the grading bands as follow. So the student evidenced exceptional digital resource utilisation, evidencing grade band 4. The student's presentation exhibits excellent use of digital resources. PowerPoint slides are visually appealing and effectively convey key information. The inclusion of photos of John's support network enhances the presentation. Despite some technical errors affecting English skills, the overall digital resource utilising aligns with the banding for grading criteria. The student evidenced advanced presentation and communication skills, so again, evidencing band 4 criteria. The student's preparation level is high, evident in key points and content coverage. They demonstrate a high level of presentation skills, making meaningful contributions to discussions. Communication skills, including body language, tone, pace, eye contact and rapport with the audience are consistently strong. The student engages effectively with the audience, maintaining eye contact and fostering a strong rapport. And evidence again is the comprehensive reflection and application and evidencing grade band 4 criteria. The student provides highly detailed and relevant reflection on key points within the report, role play and healthcare plan. They articulate clear justification for selected strategies and techniques within the healthcare plan. They have the ability to reflect on and apply feedback, which is well developed, resulting in well considered and well informed responses to the tutor's questions. They consistently and accurately use relevant references to the brief, and evidence-based practice are present. There are some areas of room for the student to review. So there was some demonstration of band 3 for communication and English skills. So there were technical errors in the PowerPoint, which meant the English skills were good rather than excellent. However, flashcards might have been more effective than A4 paper because when less successful students read from overcrowded slides, they fail to make eye contact and vary the pitch and tone of voice. So poor digital resources therefore adversely affect presentation and communication skills. So overall, the Task 3P feedback from the Summer 2023 series. So the key themes that came up in the Chief Examiner report were they observed notable improvements in the task, particularly in the use of digital skills. Students displayed confidence in compiling and professionally discussing their work from previous tasks. Well-performing students showed a thoughtful consideration of peer feedback received. Their ability to address tutor questions demonstrated a solid grasp of subject matter. Students who demonstrated a strong understanding of the benefits of their created healthcare plan and effectively explained its value, achieving higher marks. The primary concern was the lack of attention to the task brief regarding the intended audience of the presentation. Many students did not tailor their presentation as if it were for a senior colleague, spending excessive time describing the client's conditions, which would be unnecessary in a senior level presentation. Some students incorporated YouTube videos that were too lengthy, taking up a significant portion of the task. This demonstrates a lack of adherence to the brief and did not contribute to marks. Students should remember that this presentation is not intended to serve as a reflection on each task. That is the purpose of task 4. So to summarise, students showed significant improvements in digital skills. They confidently compiled and professionally discussed their work from previous tasks. Well-performing students demonstrated thoughtful consideration of peer feedback, and their ability to address tutor questions showcased a solid grasp of the subject matter. Students who understood and effectively explained the benefits of the healthcare plans achieved high marks. Lack of attention to the task brief regarding the intended audience was a primary concern. Some students did not tailor their presentations appropriately for a senior colleague audience, and effective use of time and resources, including digital resources, contributed to successful presentations. Thank you for watching. We wish you the success in the T-Level Health Core Assessment Employer Set project.